The latest discoveries in the field of medicine and how they affect the treatment and prevention of disease. In recent years, there have been numerous breakthroughs in the field of medicine that have revolutionized the way we approach treatment and prevention of diseases. These discoveries have helped us better understand the human body and its various functions, leading to the development of new drugs, therapies, and technologies that can improve patient outcomes and quality of life. In this article, we will take a look at some of the latest breakthroughs in the field of medicine and how they are impacting treatment and prevention of diseases. Gene editing. One of the most significant breakthroughs in recent years has been the development of gene editing technology. Scientists can now modify genes to correct genetic mutations that cause diseases or to enhance desirable traits. This technology has the potential to cure genetic diseases like cystic fibrosis and sickle cell anemia. Additionally, it can also be used to develop more effective cancer treatments and vaccines. Gene editing will undoubtedly have a significant impact on medical research and treatment. Immunotherapy. Immunotherapy is a type of cancer treatment that harnesses the power of the immune system to fight cancer cells. Unlike traditional cancer treatments like chemotherapy and radiation, which can harm healthy cells, immunotherapy targets cancer cells specifically, making it less toxic and more effective. This technology is already being used to treat various types of cancer, including melanoma, lung cancer, and leukemia. It is likely that immunotherapy will become more widely used in the coming years as more research is conducted. Artificial intelligence. Artificial intelligence, AI, is transforming the way we diagnose and treat diseases. AI can analyze vast amounts of medical data, including patient records and medical images, to identify patterns and make accurate predictions about disease progression and treatment outcomes. This technology can also help us develop new drugs and therapies more quickly and efficiently. AI is already being used to develop personalized treatment plans for cancer patients and to predict which patients are at higher risk of developing certain diseases. CRISPR-based diagnostics. CRISPR is a gene editing tool that is being used to develop diagnostic tests for various diseases. These tests are highly accurate and can detect diseases like HIV, hepatitis B, and Zika virus with just a small sample of blood or urine. CRISPR-based diagnostics have the potential to revolutionize disease detection and prevention, particularly in areas where access to traditional diagnostic tests is limited. Precision medicine. Precision medicine is a relatively new approach to healthcare that takes into account individual variations in genes, environment, and lifestyle when developing treatment plans. This approach allows doctors to tailor treatments to individual patients, increasing their effectiveness and reducing side effects. Precision medicine is already being used to treat various types of cancer, and it is likely that it will become more widely used in the coming years as more research is conducted. Nanotechnology. Nanotechnology involves the use of tiny particles, usually smaller than 100 nanometers, to diagnose and treat diseases. These particles can be designed to target specific cells or tissues in the body, making them highly effective. For example, nanoparticles can be used to deliver drugs directly to cancer cells, reducing the side effects of chemotherapy. Nanotechnology also has the potential to improve disease detection, as nanoparticles can be used as contrast agents for medical imaging. Telemedicine. Telemedicine involves using technology to provide remote medical care. This approach allows patients to receive medical care from the comfort of their own homes, reducing the need for in-person visits to doctors' offices or hospitals. Telemedicine can be particularly beneficial for patients in rural or remote areas who may not have easy access to medical care,